The fascination with the heart has been there since time immemorial. From the detailed anatomical drawings of Leonardo da Vinci to the modern medical images of the heart we see today, this impressive piece of machinery never fails to capture the imagination. So let's take a closer look at what makes this organ perform its vital task of keeping you alive. I'm going to use my trusted heart model to help me explain the anatomy. So this is a life-size model of the heart. And as you can see, your heart is about the size of your fist, sitting in the middle of your chest. The base of the heart sits on your diaphragm, and the apex, which is the tip of the left ventricle, points to your left side. And your heart is enveloped by your lungs, which creates this protective barrier. Usually we have quite a bit of fat protecting the heart, so your heart doesn't look as pretty as this model. Your heart is divided into two halves. The right side is responsible for receiving blood from your body and pumping it to your lungs to be oxygenated. The oxygen-rich blood is then pumped to the rest of your body by the left side of your heart. The right ventricle is the most anterior structure, and that's important because with chest injuries, it's the most likely part of the heart to be affected. On this model, the vessels are color-coded. The veins are in blue to indicate that they are low in oxygen, and the arteries are colored red to indicate that they are oxygen rich. A good way to remember this is arteries, starting with A, carry blood away from the heart. You can also see here that the heart itself has its own blood supply. These are called the epicardial blood vessels. When these arteries become blocked, that causes a heart attack. I think the best way to understand the heart anatomy is to follow the blood, and hopefully it will make more sense too. So let's start from the beginning. The blood flows into your heart via two big veins, the superior and inferior vena cava. These then drain into your right atrium. There is another vein that drains into the right atrium, that's called the coronary sinus, which drains the heart's own blood supply, the epicardial veins. The blood then makes its way into the right ventricle via the tricuspid valve. The heart has four valves acting like a one-way door, allowing blood flowing in one direction. In fact, when you listen to someone's heart, you're actually hearing these valves snap shut. And each valve is supported by tendinous cords and muscles. So the right ventricle then pumps the blood to the lungs. And to get to the lungs, the blood goes through the pulmonary valve and through the pulmonary arteries. The blood gets oxygenated in the lungs, and the oxygen-rich blood from the lungs then enters the heart via the pulmonary veins. We have four pulmonary veins, and these drain into the left side of your heart to a chamber called the left atrium. The left atrium contracts, and the pressure difference causes the blood to flow into the left ventricle. The blood again goes through another valve called the mitral valve. This valve has two leaflets, and it's shaped a little bit like a bishop's mitre, hence the name mitral valve. So now we're in the left ventricle. You can see how the left ventricle is much more muscular than the right ventricle. That's because the job of the left ventricle is to pump the blood to the rest of your body. So it's got a bigger job to do than the right ventricle, which only has to pump the blood to the lungs. The structure separating the two sides is called the ventricular septum. The final step is that the left ventricle twists and it contracts so the muscles shorten, and that force pushes blood through the aortic valve into the biggest vessel in your body called the aorta. The aorta arches, giving off blood vessels to the head and neck and to the rest of your body. Now this circuit is repeated constantly with each and every heartbeat. That's around 100,000 times a day. That's pretty impressive, right? So that's an overview of the heart anatomy. If you like this video, don't forget to like and subscribe. I hope that was helpful, and thanks for watching.